โมงถัดไปเนี่ยค่ะได้รับการสนับสนุนโดยบริษัท Biomed Session เรื่อง Stress Urinary Incontinence Management ระหว่าง Vaginal Laser vs Conventional Surgical Repair นะคะเราได้รับเกียรติจากอาจารย์อรเกตนะคะอาจารย์อรเกตปัญญาเนตินาถค่ะจะมาเป็น moderator ให้เรานะคะอาจารย์อรเกตเนี่ยจบที่คณะแพทยศาสตร์จุฬาลงกรณ์นะคะเกียรตินิยมอันดับ1นะคะไปเทรนเดอร์มาโตอเมริกันบอร์ดของ Anti Aging แล้วก็ Regenerative Medicine ได้รับเกียรตินิยมอันดับ1เช่นเคยนะคะแล้วก็สอบ OB-GYN นี่ได้เป็นตำแหน่งที่1นะคะปัจจุบันอาจารย์มีความเชี่ยวชาญนะคะเรื่อง Aesthetic Anti Aging แล้วก็ Regenerative Medicine ปัจจุบันปฏิบัติงานอยู่ที่โรงพยาบาลบางกอก9 International นะคะเรียนเชิญอาจารย์อรเกตค่ะ
ขอบคุณค่ะสวัสดีค่ะทุกท่านนะคะยินดีแล้วก็เป็นเกียรติมากเลยที่ได้มาแชร์ประสบการณ์กันในวันนี้นะคะเนื่องจากสปีกเกอร์อีกท่านหนึ่งมาจากต่างชาติจะขออนุญาตเลคเชอร์เป็นภาษาอังกฤษนะคะ Okay, in this session we're going to talk about how we can use the erbium yak laser to treat our intimate area. I'm Dr. Ornkes Panyanetinad, dermatologist and international speaker. Have any of you have been using the laser before? Anyone here have ever used the laser? Please raise your hand up. Wow, okay, so it's really new stuff for you. Next slide, please. So, the brain is viewed as an appendage of the genital glands. Carl Jung. Have you ever heard this quote before? He is the really famous psychiatrist from Switzerland. And from this quote, we can imply that actually our genital glands is really important organ that we cannot overlook. So, because many of you have never used the laser before, I will give a brief wrap-up. What is the laser and what is the theory of thinking when the laser have its work and how can it do in the dermatological way. And after that, Dr. Rosso will wrap up all the things in OB-GYN. The term laser originates as the acronym for light amplification by stimulated emission of radiation, LASER. A laser is a device that emits light through a process of optical amplification based on the stimulated emission of electromagnetic radiation. With laser, we have many applications, from the optical disk drive, laser printer, barcode, using it in the military way. But as a doctors, it is related in our laser surgery and skin treatments. Altogether, we can use it to cut and resin all the materials. And this is how laser work. Laser lights differ from ordinary light because the laser light is monochromatic, unidirectional, and it is coherent. This is a really important slide for the one who want to use laser. The keyword of using laser is the source of the light that make each laser different from the others. You may have heard the KTP laser, dye laser, ruby laser, Alexander laser, diode, ND-YAG, erbium YAG, and CO2 laser. The name is named after the source of the light. That is the one thing that you have to know. But the most important point that you have to know is the word chromophore. Chromophore is the target tissue that energy will absorb the most and have its action. Today I'm going to talk about the erbium YAG laser. Erbium YAG laser is the laser with 2,940 nanometers wavelength and its chromophore is the water. So it's quite work well when you treat in the moist area because its chromophore is the water. And this is the histology of the skin. You will see that in the skin we have the stratum corneum as a part of the epidermis, papillodermis, reticulodermis, and the hypodermis. Normally, the thickness of the skin is around 1.5 to 4, depends on each person and each area. And this is the histology and the action when the erbium yak laser put in the skin. You will see that in 2 days, 7 days, 21 days, there is the change in the histology under the skin. So it implies how can this laser work under the skin. This is one of the work that I have presented in the IMCAS World Congress in Paris. You can see that for the external genital layer, we can use the fractional MCL laser to do the external genital layer rejuvenation, lightening, and also it can improve the texture, elasticity, and the collagen in the skin. So this is a picture that can see obviously outside. Let's see inside. This is the histological layer of the vagina. There is the epithelium, lamina propria, fibromuscular, and the adventitia here. From the study, the MCL can increase the thickness of this layer from 2 millimeters to 3 millimeters. And next, let's join the session with Dr. Rosso. Dr. Rosso is an expert OB-GYN in Croatia, and he works a lot with fractional erbium MCL laser. So he is so kind to share his expertise with us. It would be kind of you to give him a big hand, please.
Greetings to all of you, my dear colleagues. I'm Dr. Rosso, coming from Croatia. This is my second time being in Bangkok, thanks to Technical Biomed, their invitation for presenting things about the lasers. I'm very glad that I'm second time here. I hope that this presentation will be interesting for you. Topic of my presentation is advantages and possibilities of erbium yak laser in gynecology with theory and results. So we are talking about MCL31 dermablade erbium yak laser. This is the 6th generation of erbium laser, who is more powerful, faster, more efficient, precise, selective, and what is most important, minimal invasive. This laser we can use in field of gynecology, dermatology, and aesthetic anti-aging medicine. In my country I have a private polyclinic, so we're using this laser in all aspect ratio of use. In dermatology and aesthetic anti-aging medicine, in dermatology is most popular for the perfect ablation tool for removing moles, scars. In aesthetic anti-aging medicine, very popular for complete skin resurfacing, for complete rejuvenation of skin of the face. For gynecology, you will hear through my lecture. So, general specification about this laser: it is a 2,940 nanometers wavelength, and it has a very powerful fluence to 150 joules. It can perform ablation, thermal, and microspot. The main difference between erbium laser and CO2 laser is in wavelength. So, as I said, erbium laser is 2,940 nanometers, and what is most important, has a peak of water absorption. That means that first shot he shuts water in the cells. CO2 laser is less, has absorption at 10,600 nanometers. CO2 lasers are mostly used in medicine for cutting, for operating, but some of these CO2 lasers can perform similar things like erbium laser. The wavelength of this laser was the main reason why I have chosen erbium laser, because of lateral thermal damage. So when we are comparing CO2 laser and erbium laser, we will see that CO2 laser has a very low water absorption, has deep uncontrolled ablation, and uncontrolled thermal effects with necrosis, and cannot perform cold ablation. So when we are proceeding the same procedure with CO2 and erbium laser, we will see that we will have less necrosis of the tissue with erbium laser. That means lower downtime for the patient, and that means that the pain will be less with erbium laser. In gynecology, we are using V-spot handpiece, and recently Asclepion launched a SteriSpot single-use handpiece. In my office, I often use a V-spot handpiece. Also, what we can use in gynecology is microspot handpiece and Variotim for operative procedures in gynecology. When we are performing the vaginal laser in gynecology, we are performing mostly in two phases. First phase is ablative fractional mode, in GYN-C mode. Respecting the protocol, Asclepion has a very well organized academy in Vienna, where if you buy a laser, you will learn the basics for the starting of procedures, and always you start with respecting the protocols for the patient. Second phase, when we are performing, is the thermal mode, also in GYN-V mode. What is our goal? What is our main reach, what we want to reach in gynecology? So when we are using this V-spot, you see that we have a deflector gold coated or 90 degree, and we are targeting specific area at 300 microns in a layer of mucosa and submucosa. So we are targeting submucosal tissue to start the process of revascularization and revitalization of the tissue. If we are performing outer laser for vulva and vestibulum vagina, then we will have a third phase of the treatment. For that treatment, we are using microspot handpiece, meaning non-ablative. And for that treatment, we will need using of anesthetic cream 15 minutes before the laser, because if you cannot perform the procedure in office practice without anesthetic cream. When you are using anesthetic cream, the patient will feel no pain. This is just a little video showing me testing laser before with microspot handpiece. I'm showing you to imagine what really happens also on the skin and at the vagina. As you see on these papers, we have perforated 4 or 3 papers, depending the depth of perforation depends of our settings. That means each patient needs to be set depending of the age of the patient, of the mucosal status and indication we are wanting to treat. So the penetration will be deep as we have settings before done. That means that the damage will not make a laser, damage will make when we are in the wrong setting. So we must understand this is not some laser, some cosmetic playing tool. This is a serious operative aesthetic laser with which you have to know how to handle. Again, about the SteriSpot handpiece. This is a short new 3D animation of Asclepion, showing you what exactly happens when you put this handpiece in vagina. Once you put this handpiece in vagina, this is a blind procedure. Because of that, everybody asks me why I bought Asclepion. Because it is a laser with you can trust that he will do the job you presenting has done before. As you can see, you are treating whole vagina tissue, rotating the headpiece 360 degrees and targeting submucosal tissue. We must normally respect the protocols, but also we need to make some modification depending on the indication. Normally, when we want to treat patients with stress urinary incontinence, we will have to put some extra shots, suburethral and parauretral, and also when we are targeting vaginal relaxation syndrome, when the vagina enlarged, we will have some extra shots in the fornix of vagina. Why is this procedure so effective? This is a 3D mesh I created for better understanding. At the first 1 year using the laser, I was a little bit confused because always when the patient came under control, I have expected to see some big anatomical changes. You will not see big anatomical changes, for example, for a patient treating stress urinary incontinence, but what most important is when a patient cannot control 10 or 15 days after the treatment, most important is that they say they feel better, they don't have any more symptoms of stress urinary incontinence. So what actually happens and why is this procedure so effective? When you imagine the vagina like a tubular organ, when you are passing vagina from proximal to distal part, we are making thousands and thousands microablative zones. You see this on this presentation. Thousands and thousands microablative zones. The tissue will react immediately after the laser to start reparate and start the process of recollagenization and revascularization. And what actually happens at micro level? Macroscopic you will not see a lot, but micro level we have actually performed a mesh like a spider mesh of new connecting tissue, and definitely there will be changes anatomically looking from the vagina, upper bladder and down rectum. Because of this is why this procedure is so effective. So indication in gynecology, we can treat stress urinary incontinence, vaginal relaxation syndrome, vaginal prolapse, vaginal atrophy, vulvar intraepithelial neoplasia, VIN1, low seal, and removal of the tumors of the vulva. Shortly about vaginal relaxation syndrome is common syndrome with women who has 1, 2, or 3 vaginal delivery. Vagina is enlarged with a low and poor tone of vaginal walls. So when you perform a digital examination, you will feel no resistance at the fingers, and these women suffers for bad quality of sexual life, and also with the time the prolapse can occur. These are some pictures showing enlarging the lateral and upper and lower walls of vagina. We have to start treat these symptoms when is the time, so we can start from 35 years to up, and also after delivery, 6 months after delivery, we can perform vaginal procedure, and all patients report better quality of life and better sexual life after the treatment because of better friction and better tonus of vaginal walls. Also, if there are initial stadium of prolapse, we will stop the prolapse and improve the status in vagina. This is a short video showing procedure of vaginal laser. When we are performing vaginal laser in these 2 phases, this is a non-painful procedure. We can do it in a few minutes. When you ask the patient, does she feel anything? Does she feel some pain? She said, no, there is no pain. She sees something strange. What's strange? She feel a laser in her vagina because she never have a laser in vagina, but actually there is no pain. Sometimes when vagina is enlarged, when laser is out of the focus, then you will hear some shots, and she can feel a little bit warming in vagina, but pain no. So the procedure is very fast. You can perform it in 10 or 15 minutes. After the laser, she can normally do what she don't need to stand still or something. 7 hours, 10 days after procedure, she can have normally sexual intercourse. This is a short video showing laser for externa genitalia, for vestibulum and the vulva. Before that procedure, as I said, we have to use anesthetic cream. During the procedure, there is no pain, but 1 day after procedure, she will felt like a burn on the sun, and she will need to take and use some cream for hydration of the tissue. It is a very good procedure and helps to rejuvenate skin and mucosa of vulva and vagina. This is some picture showing a 45-year-old woman. She has all symptoms of stress urinary incontinence. She has also starting vulvar atrophy. She had 3 childbirths, heavy births, 4.5 kilo. As you can see on the third picture, we have made a vaginal and external laser, but I'm showing you the third picture for external laser. You can see actually improvement of the tonus of labia minora and majora, and what is also important, you can see the better and healthier color of the vestibulum of vagina. Also, she reported loss of the symptoms, and that is also important. I have performed the laser for stress urinary incontinence. That was before 2 years, and she don't report relapse of the symptoms. That means first time when she report relapse, we can do another laser for treatment. So that means that the laser that we are performing a laser with a long-lasting effect. This is a picture showing treatment laser for stress urinary incontinence. I want you to looking very good these third pictures. You can see actually big difference in the quality of tissue of vaginal mucosa. In my polyclinic, I have computerized gynecological tables with integrated HDV colposcopes, which have enlargement of 500 times. At the third pictures, you can see drastically improvement of mucosa. So, what actually happens when we are passing vagina once, we are covering 25% of vagina, 75% will be untreated. So actually after the first laser, we will change 25% of whole mucosa of vagina. After that, the lubrication will be much better. And also what is most important, the infections will not be so often like it was before. This is some demanded patient. At first year of using of this laser, I didn't use for these demanded indications because I want to well-known and want to trust the laser. This is actually a patient 72 years old. She has before 2 years classical hysterectomy because of the total prolapse of uterus and vagina. And what often happens after classical operation, you have this problem. This is a prolapse, but this is actually enterocala. So behind the wall of this first picture is not a bladder, it is intestine. So I was a little bit afraid because before the laser, actually you can see the peristaltic movement of the intestines. So I have performed 2 lasers for T very carefully. And you can see after the first and second duration, you can see retraction of the cystocala, and you can see improvement of the quality of mucosa of vagina. It's a very good result. This is a patient 70 years old. She has a cystocala, but what is important, she has a cystocala without stress urinary incontinence. This is very important because sometimes when you go a classical operation of cystocala, who has no stress urinary incontinence, you can after operation has a complication that you have a patient with incontinence. So at the first when she came to me, I said go under the classical operation. She said, doctor, I don't want to go to classical operation because she has a regular sexual intercourse with her husband, and she was afraid of complication of classical operation. She asked me, can we help? I said, we can try. This is also demanded area. So we have tried and we have a very good results. As you can see, we have performed 3 lasers. After each laser, we have improvement. And at the last picture, this is after third laser, you can actually see in vestibulum of the vagina. Last picture is when we are telling the patient that to push to make a valsavi. At the last picture, I'm telling the patient to push, but as you can see, nothing comes out. So this is a big success, and she is very satisfied. This is the similar thing, a 60-year-old patient. As you can see, she has a cystocala. A third picture is when we are telling the push to make a valsavi. I have also performed free lasers. At the last picture, you can see actually vestibulum, also big success, but these are very demanded area because you have to have minimum 2 or 3 years experience with the laser. You have to know how to shoot. You have to know where to put the extra shots to the vagina, and you must be very sure for the settings for the vagina to not to do complications. These are patients with 72 years old, which she has a stress urinary incontinence and also atrophy. We have performed also 3 lasers. After second laser, she reported loss of stress urinary incontinence. And at the last 2 pictures, you will see anatomical improvement. You can see through the vestibulum, and you can see the improvement of mucosa of vagina. Also big success. This is a picture showing that we must be very careful. As I said before, these all procedures are fractional treatments. That means that we are performing microablative zones. So, for example, when we have a pattern 1.3 centimeters, we are placing 169 laser beams in the pattern. So, when we are performing microablative treatment, the healing will be faster, downtime will be faster. At last 3 pictures, this is not complication. This is what happens to me. You can see that there, I didn't make microablative zone. I have actually made a complete ablation of mucosa. So to this patient, we cannot say you can have a sexual intercourse 7 to 10 days after the procedure. For that complete rehabilitation, you will need minimum 3 or 4 weeks. But what is important with the tissue of vagina, vagina has a fascinating ability to reparate the mucosa. Most demanded area is vulvar and vaginal atrophy. So I say to all my colleagues, start to treat the patient when it's still a time. So start to treat the patient from 40 to up. Why in these years? Because at that years you have still enough matrix in the tissue to start the process of recollagenization. When you have a patient like this, 75-year-old, this is a big problem, but because you can see synechia at upper and lower commissure, you can see ragads, the tissue is very fragile, and when you touch it, contact the bleeding. So when we are treating these things, we love to combine the laser with PRP therapy. For that treatments, we will need 3, 4, sometimes 5 lasers, because we have go with very low laser settings, not to make a damage, not to make more synechia at external genitalia and in vagina also. Results with PRP are very good, but you have to be very patient and very careful with that kind of the patient. So this is something new. This is operative procedure, what can dermablade perform. This is actually video showing a 24-year-old patient. She has these sexual transmitted condylomas. She has large findings at labia minora, labia majora. She was very unsatisfied. She went under the treatment of cryotherapy with no help. She started also with using this cream Aldara, but without any help. She came to me. As you can see, this is a large finding. I have performed this procedure in my office practice without need of general anesthesia. Before procedure, I have put anesthetic cream, and after anesthetic cream, we have injected lidocaine with microneedle 4 mm treated gauge. And you can see actually this fascinating laser in action, how is ablating, how is smoothly and very precisely removing the sick tissue. What is good after the laser, you can see on this picture one side done and second to do. After the laser, when you are proceeding for condylomas, you will have not recidue. You will have some new at the other place, but there where laser was, you will have no residue. This is a picture immediately she before and after the laser. Must say she is very satisfied. And for the end, I want to present you something completely new. As you know, I'm also a subspecialist in gynecologic oncology, so in my practice, every day I perform operative procedures on the cervical part of the uterus for pre-invasive lasers, performing radiofrequency loop and lens excisions with pathological findings. And as I'm performing these operations for the various spots, as you see with condyloma, I thought it will be very nice to have a handpiece which can perform operation, cutting, and evaporization. So I remembered before 2 years when I was in the Asclepion Academy in Vienna, I show especially this one slide, and I showing you why. Because, as you know, erbium laser is one laser with one leg, CO2 laser is second laser with second leg. So CO2 are operative lasers, and erbium lasers are ablative lasers. And I listened very carefully, and one of the engineers explained that erbium laser, when we are combining fluence, pulse length, pulse durations, and spot size, we can have in the middle the same effect like a CO2 laser. So with erbium laser, we can have the same effect like a CO2 laser, meaning cutting. So I contact them in Asclepion, and I ask them, is it true that it can perform these things? And is it possible to make a handpiece with which we will be enabled to operate in vagina through the speculum? They said at first, Dr. Rosso, yes, technically it is true, but it is a very demanding area because we have to have a special optic. We have to have a spot size 0.5 to 1 millimeter, and this is a technically very demanded area, but they will try. And they say they have to make a handpiece which is not thick, that you can go through the speculum, that you see what you are actually doing. And after 7 or 8 months, they called me and they made a prototype. And this is a prototype, and this is something completely new. And this is actually the first time world presentation of the erbium laser with a handpiece who can perform cutting and evaporization. So I had this handpiece around 7 months. I have performed a lot of operations, but always I am performing operation together with radiofrequency loop and lens ablation and cutting with pathological findings. Indications for this handpiece will be cervical intraepithelial neoplasia grade 1, cervical ectropion, VIN1, vaginal intraepithelial neoplasia low seal, VIN1, vulvar intraepithelial neoplasia low seal, removal of the tumor of the cervix, vagina, and vulva, and resection of the septum of the vagina. I will show you now a short video. This is a bad quality video, but you will, because it was a problem to me to make operation and looking at the camera of the colposcope, but actually you can see the cervical portion of the uterus. And I have combined radiofrequency loop excision with pathological, and you can see now actually evaporization. You can see that we are very easy entering in the stroma of the cervix, and you will see there is actually no bleeding because it is the laser. The laser are the best, as you know, but also the most expensive. But for the patient, the best one. You can see the second patient, we perform colposcopy, cervical block. This is done under cervical block with no need of general anesthesia. First time performing, as you saw, a loop excision for pathohistology, and now you will see clearing the edges with the laser. Always careful with the start, but I say I'm very satisfied, and this will be not a primarily tool, but this will be very helpful tool for those who knows what I'm talking about. When we have changes at the fornix of vagina, upper fornix, lower fornix, where the complications are not rare because of possibilities of complication like fistula, like vesicovaginal fistula or rectovaginal fistula, this laser will be a perfect tool for very precisely removing the changes, because a laser is for sure more precise than my hand. This is immediately after laser. This is 2 weeks after laser, you see granulations. This is 4 weeks after laser. And actually you can see picture before with the colposcopy, and after we have a healthy young woman who is very satisfied. And for the end, I would like to say that the laser treatment performed by Juliet are fast, effective, painless, and minimal invasive with very low risk of side effects and minimal downtime. Thank you.
Wow, really nice presentation. Thank you so much, Dr.
Thank you.
Rosso. คำถามจากฟลอร์มีสงสัยเรื่องอะไรที่อยากจะถามดร Rosso ไหมคะ ยกมือ participation กันได้เลยค่ะ เป็นโอกาสดีที่คุณหมอ Rosso ข้ามน้ำข้ามทะเลมาให้ความรู้พวกเราอะนะคะ ขอผู้กล้า
If there is any question, I will be glad to answer if I know how. Just ask.
ระหว่างรอผู้กล้านะคะพอดีมีคำถามที่ได้รวบรวมจากฟลอร์มาก่อนหน้านี้นะคะ มีคำถามว่าในกรณีที่ใช้ MCL laser เนี่ยนะคะตัวเลเซอร์เนี่ยจะสามารถไปกระตุ้นความผิดปกติของเนื้อเยื่อภายในหรือไม่นะคะ Dr. Rosso, that's the question from the floor. Whether this MCL laser can promote any cancerous formation
Again,
to induce the cancer. Whether this laser can induce the cancer.
as you saw, for meaning this operative handpiece for operation or treating the ladies after the operation of the cancer. I can say in our country the MCL will be the golden standard, for example, for the very young woman who has an operation of breast cancer, because as you know it's increasing incidence of the breast cancer who are very depending of the hormones. So after the operation of these women, mostly of them go under the chemotherapy, or to them they are performed ovariectomy by laparoscopic. So they will in very early ages go to menopause, and they will have serious problems with the early stages of vaginal atrophy, and that will definitely offend of their quality sexual life. So it will be the golden standard for starting the treatment for a young woman who has operation of the breast cancer with ovariectomy, because that woman cannot take hormonal therapy. Also, after the operation, any gynecological cancer, there is no contraindication for performing laser for rejuvenation of the tissue of vagina and the vulva, because we are not in collision of the cancer. So this is, if that was your question.
โอเคค่ะ ก็คือคำตอบจากดร Rosso นะคะคำถามจากฟลอร์นะคะ MCL laser เนี่ยมีหลักการทำงานนะคะหรือว่าผลอย่างไรถึงสามารถทำให้รักษาปัญหาการเกิดปัสสาวะเล็ดได้ค่ะ Dr. Rosso, the question is
Yes.
How can you explain the theory and the mechanism of action? How can this MCL laser help with SUI?
With SUR, because when you are, what is most important, when you have a patient, before the laser you have normally to perform a gynecological complete examination with ultrasound. You have to have a pap smear normal, and you have to have normal urine culture. So when you are treating a patient with stress urinary incontinence, you have to exclude other possibilities of stress urinary incontinence, meaning damages of spinal cord, meaning some complications with the patient who has diabetic neuropathy, You can treat actually first stages of stress urinary incontinence, sometimes combined with mixed stress urinary incontinence. My experience will be like this. We have the best results starting treating the patient in years from 35 to 50 years. When we will start to treat the patient? When she first time reports the problem with stress urinary incontinence. That means when she is walking along, smiling, going exercising, and when she says first time that she cannot control the bladder, that is the time when we start to treat. Don't wait progression of the effects. And now what is the important for good results? When we are treating stress urinary incontinence, as all of you know, why stress urinary incontinence happens. Stress urinary incontinence happens because of loss of, which is very important, suburethral support. So suburethral support is cause of stress urinary incontinence. So when we are proceeding a laser with good results, we will proceed the laser respecting the protocol, but we will also have to put some extra shots, parauretral and suburethral. And I can say I do like to perform 2 lasers from stress urinary incontinence for better and long-lasting effect. After the first laser, 80% of the women report loss of the symptoms, and after second laser, almost 98% of the women report loss of stress urinary incontinence. I can tell you one, this is interesting story, this is a big reward to me. I told to doctor, before 2 months came to me my colleague, and this is the best when a colleague comes to the treatment. She is old, 57 years, and she is actually an abdominal surgeon. And as you know, as abdominal surgeon, she has to stand a lot of hours in the operation room and so. And she came to me and said, Dr. Rosso, I have a problem. Last 6 or 7 years, I have a problem with incontinence. Every each half hour, 1 hour, I have to go to toilet. And this is a big problem for me when I have to operate some operation in duration of 3 or 4 hours. And she said, can you help? I made exam. There were no big anatomical changes. They were starting atrophy because 57 years old. And we have performed a laser. 15 days after the laser, she came to me, kissed me with a smile on the head, on the face. She said, Dr. Rosso, after 7 years, this is the first time that I didn't have to wake up and go to urinate 2 or 3 times, and also when I'm performing operation, I can operate now 3 or 4 hours without leaving the patient and team and go in the toilet and come back in the operation room. So this is a big success.
Wow, impressive story. How long does the effect of the improvement last after the treatment?
Lasting of effect is depending of the age. This is primarily of the patient, of the symptoms, and of the status of vaginal mucosa. This is what is very important, because when we have a younger woman, we can shoot with the laser with high affluence, because tissue has enough water. As you all know, erbium laser is targeting the water in the cell. When we have a patient and then effect, when we go with high affluence, effect will be 1.5 and more, 2 years and over. You can repeat the laser when you have a relapse of the symptoms. But when you have a patient together, stress urinary incontinence with atrophy, you will go on lower setting, more laser procedures, and effects are also good, but you will have to make minimum 2 or 3 laser treatments, sometimes together with PRP.
ค่ะก็คำถามนี้เป็นคำถามที่ดีมากนะคะโดยสรุปนะคะคำตอบสำหรับคำถามนี้นะคะก็คือ fractional MCL laser เนี่ยสามารถช่วยลดปัญหา SUI ได้โดยการกระตุ้นเนื้อเยื่อนะคะบริเวณรอบๆนะคะเพื่อ support anatomy บริเวณนั้นให้มีความยืดหยุ่นแล้วก็ความแข็งแรงมากขึ้นนะคะโดยโปรโตคอลที่ดร. Rosso ใช้เนี่ยก็คือจะบอกว่าไม่ปล่อยให้คนไข้เป็นหนักนะคะก็คือ early treatment first โดยที่ทันทีที่คนไข้เริ่มมีคอมเพลนที่บอกว่ามีปัญหาตั้งแต่แรกๆเนี่ยให้คุณหมอเริ่มทรีตได้เลยซึ่งคุณหมอ Rosso เนี่ยเริ่มทรีตคนไข้ตั้งแต่อายุ35 ปีที่มีคอมเพลนนะคะแล้วผลการรักษาเนี่ยหลังจากการรักษาครั้งแรกเนี่ยในประสบการณ์ของคุณหมอ Rosso เนี่ยพบว่าในแค่การรักษาครั้งแรกนะคะ 80% ของคนไข้มีอาการที่ดีขึ้นค่ะส่วนหลังจากรักษาเนี่ยอยู่ได้นานขนาดไหนนะคะก็ขึ้นอยู่กับอายุแล้วก็ความรุนแรงของปัญหาค่ะอันนี้คือสรุปสำหรับคำถามนี้นะคะมีคำถามอื่นๆจากฟลอร์ไหมคะ Okay the question please Dr. Rosso
Thank you so much for your nice presentation นะครับ My name is Dr. Suvit สวัสดีครับผมอาจารย์สุวิทย์นะครับผมหมอสุวิทย์ปัจจุบันเป็นประธานอนุสาขาวิทยาศาสตร์เชิงการสตรีนะครับหรือว่าที่น้องๆรู้จักเกินชื่อเก่าที่ Gynaecology นะครับเดี๋ยวพรุ่งนี้ก็จะมาคุยเรื่องเกี่ยวกับเรื่องเพลอาการโพลับฝั่งพวกนี้ก็จริงๆ let me share some information for my Thai colleagues จริงๆเรื่องเลเซอร์เนี่ยเป็นเรื่องใหม่นะครับที่คุณหมอผู้นี้น่าสนใจที่จะมารักษาพอยสำคัญปัจจุบันเลเซอร์เนี่ยจะมี innovation ที่ดร. Rosso พูด3อย่างคือเรื่องของ rejuvenation นะครับอันที่2คือเรื่องของรักษาพวก pelvic organ prolapse อันที่3คือเรื่อง stress incontinence ปัจจุบันเนี่ยข้อมูลแล้วก็อันที่4ก็คือเรื่องของ vaginal atrophyปัจจุบันเลเซอร์ทั้งหมดเนี่ยเนื่องจากมันเป็นการรักษาเนี่ยเครื่องมือใหม่ปัจจุบันข้อมูลออกมาเนี่ยมันมีข้อมูลเปเปอร์ที่ตีพิมพ์น้อยมากแต่เปเปอร์ที่ออกมาที่เกี่ยวกับปัจจุบันที่ข้อมูลที่เยอะที่สุดคือเรื่องของ vaginal atrophy เพราะว่าทั้ง CO2 เลเซอร์แล้วก็แยกเนี่ยนะครับerbium แยกเนี่ยนะครับสามารถช่วยเรื่อง atrophy ได้ผลค่อนข้างดีซึ่งมี RCT ออกมาหลายเพื่อเริ่มจะออกมา 1-2 อันนะครับเพราะว่าได้ผลดีแต่ในเรื่องของ stress incontinence กับ pelvic organ prolapse เนี่ยส่วนใหญ่ที่ออกตีพิมพ์หรือรีพอร์ตส่วนใหญ่จะเป็นแค่เคสซีรีส์เล็กๆนะครับแล้วก็ใน stress incontinence เนี่ยผลที่ได้ส่วนใหญ่จะเป็นคนไข้ที่มีปริมาณปัสสาวะปริมาณเล็กน้อยและช่วยให้ดีขึ้นแต่ว่ายังไม่สามารถมีข้อมูลที่จะบอกว่าสามารถช่วยทำให้แห้งหรือหายได้ในคนไข้ที่มีปริมาณมากเพราะฉะนั้นเราคงต้องรอดูต่อไปข้อมูลระยะยาวว่าข้อมูลระยะยาวจะเป็นยังไงส่วนเรื่อง long term efficacy เนี่ยเหมือนที่บอกแล้วคือปัจจุบันเนี่ยเนื่องจากตัวนี้มันออกมาใช้ได้ยังไม่กี่ปีเพราะฉะนั้นเราคงจะบอก long term efficacy ไม่ได้ซึ่งเรื่อง safety เนี่ยเนื่องจากตัวเลเซอร์เนี่ยเหมือนที่อาจารย์ที่บอกได้เรียนมาว่ามันเป็นตัวที่ควบคุม energy ข้อดีของมันก็คือภาวะแทรกซ้อนที่เขารีพอร์ตมาเนี่ยมันพบไม่เยอะพบน้อยถ้าทำอย่างระมัดระวังแล้วก็ตามโปรโตคอลเขาดีแต่ข้อเสียอีกอันนึงคือต้อง drawback ต้องคิดถึงก็คือเรื่องของค่าใช้จ่ายเพราะเครื่องมือมันมีราคาใช่ไหมอาจารย์มันประมาณเกือบ 3-4 ล้านแล้วแต่
ประมาณนั้นนะคะแล้วแต่ว่าบริษัทจะลดราคาหรือเปล่า
ก็คือเครื่องมือมีราคาแพงเพราะฉะนั้นการจะเลือกใช้เนี่ยพวกเราก็หลักก็คือว่าเราคงจะไม่ปฏิเสธ new technique เพราะมันจะมีประโยชน์เนื่องจากเป็น minimal invasive แต่คงต้องพิจารณาเรื่องราคานะครับความคุ้มค่าแล้วก็ประสิทธิภาพของการรักษาแต่ละกลุ่มเช่นถ้าอาจารย์จะเอามาใช้อะโทฟีตัวนี้มีนะว่าอะโทฟีก็จะเหมาะเพราะมันมีข้อมูลว่าเปรียบเทียบ RCT ได้ผลดีเพราะมันเป็นยิงเข้ามาในช่องคลอดนะครับแต่ข้อเสียก็คือราคากลุ่มไหนอาจจะเหมาะอะโทฟีสมมติอะโทฟีที่เหมาะปัจจุบันเนี่ยก็น่าจะเป็นกลุ่มของพวกมะเร็งเต้านมที่เขาบอกสเตรเบสที่เราไม่อยากใช้ว่าจะน่าเอสโตรเจนใช่ไหมครับเพราะว่าการยิงเลเซอร์เนี่ยครั้งหนึ่งประมาณ 1-20,000 บาทค่าใช้จ่ายนะครับแล้วแต่บริษัทแล้วแต่เครื่องว่า CO2 หรือแยกว่าจะยิงบ่อยขนาดไหนใช่ไหมอาจารย์
ใช่ค่ะ
ทุก6 เดือน efficacy มันจะ last แค่6 เดือนถูกไหมฮะต้องยิงซ้ำเพราะฉะนั้นก็จะแพงกว่าการใช้ฮอร์โมนเพราะฉะนั้นตอนนี้ก็น่าสนใจในกลุ่มของเซเบสที่กินทาร์บอกซิเฟนเพราะจะมีช่องคลอดแห้งการใช้เลเซอร์ก็อาจจะมีประโยชน์หลบเลี่ยงเอสโตรเจนแต่คนไข้ทั่วไปอันนี้เราคงต้องพิจารณาเรื่องความค่าใช้จ่ายนะครับก็ฝากไว้แค่นี้นะครับ
Can I say something? I understand just a little bit,
okay,
but
sure,
I want to make an accent also of vulvovaginal atrophy. The main problems with the woman in age 45 years and all is the dryness of vagina and painful sexual intercourse because, as you know, the atrophy happens. We cannot avoid it. In my country, they don't want to take synthetic hormones anymore, so the best treatment will be the laser. I have to say that with vulvovaginal atrophy, when we are performing procedure, after the first laser, 80% of the patients report normal lubrication of the vagina. That means that it's very important that they will not reject their partners for the sexual intercourse. and after the first and second laser, they can have a normal sexual intercourse. That means that big improvement is done, revascularization and rejuvenation of the vagina of the vulva. But what is important, you have to start when is the time to start. As I said, when there is in tissue enough matrix for make recollagenization. Don't wait atrophy. Start with the laser from 42 up. Thank you.
โอเคค่ะที่พอยนี้พอยที่อาจารย์สุวิทย์เนี่ยเรสประเด็นขึ้นมาเนี่ยสำคัญมากนะคะเพราะจากประสบการณ์ที่รักษาคนไข้มาเนี่ยในเรื่องของSUI เนี่ยคนไข้ที่ได้ผลค่อนข้างดีเนี่ยจะเป็นเคสที่มีอาการค่อนข้าง mild to moderate แต่คือ severe symptoms เนี่ยผลก็ต้องยอมรับว่ายังสู้ surgery ไม่ได้นะคะแต่จะเหมาะกับเคสคนไข้นะคะที่ต้องการรักษาโดยไม่ผ่าตัดนะคะแล้วก็ต้องการ early intervention นะคะส่วนเรื่องคอสเนี่ยเรื่องกลุ่มของคนไข้เนี่ยจริงๆมีกลุ่มคนไข้อยู่เยอะพอสมควรเลยที่ต้องการที่จะจ่ายเพราะว่าไม่ต้องการผ่าตัดนะคะแล้วก็อีกประเด็นหนึ่งที่ดร. Rosso raise ขึ้นมาคือเรื่อง sexual intercourse satisfaction นะคะเรื่องความพึงพอใจในการมีสัมพันธภาพทางเพศนะคะเรื่องนี้เป็นเรื่องที่บางทีคนไข้อายที่จะพูดกับเราแต่จริงๆคนไข้ต้องการการรักษาแล้วคนไข้กลุ่มนี้ก็ willing to payนะคะจากประสบการณ์ที่เคยรักษามา so Dr. Rosso Dr. Sweet raised a very great point about the candidate case selection for the SUI. He mentioned that in the case that have the really severe symptoms, the laser is not comparable to the surgery. So what is your tips and trick for the candidate case selection, which is really important for the treatment?
As I said, the important is to make a right selection. We are treating the earliest stage of stress urinary incontinence, stage 1 and stage 2, and trying to avoiding mixed patients with mixed stress urinary incontinence or some big anatomical defects together with atrophy. So when you have a clear stress urinary incontinence grade 1 patient, you will have, as I said, excellent results, but in years 40 to 50, when the patient is older, we have to use, my recommendation is to use PRP, because once you are performing the laser procedure, whether that is the skin or vagina, we are opening channels in mucosa. This is very important. After the laser, we have 4 hours to drug delivery, and the best will be PRP, which is prepared from the patient blood. And we have no side effects, and the results are better, and the recovery is much faster.
Okay,
but as I said, it's not only the protocol. You have to play a little bit with the handpiece.
Okay ค่ะเรื่องของ PRP นะคะไม่แน่ใจว่าคุณหมอเคยได้ยินหรือว่าได้ใช้ PRP มาหรือเปล่านะคะ PRP เนี่ยย่อมาจาก platelet rich plasma นะคะ process ของ PRP เนี่ยก็คือใช้เลือดของคนไข้เนี่ยไปผ่าน process กระตุ้นให้มีการหลั่ง growth factor นะคะเพื่อช่วยซ่อมแซมเนื้อเยื่อนะคะหลังจากทำการรักษาด้วย MCL เนี่ย MCL เนี่ยต้องอธิบายก่อนนิดนึงว่าหัวเนี่ยมีทั้งหัวที่เป็น full ablate นะคะกับ fractional ablate ความแตกต่างของ full ablate กับ fractional ablate คือหัว full ablate เนี่ยก็คือ treatment area ที่ได้รับพลังงานเนี่ยจะรับพลังงานทั้งหมด 100% นะคะแต่ถ้าเกิดเป็นหัวที่เป็น fractional ablate เนี่ยจะรับพลังงานแค่บางส่วนเพราะฉะนั้น tissue recovery ก็จะเร็วกว่าหลังจากที่ทำการรักษาเนี่ยพอเนื้อเยื่อมีการเปิดแล้วเนี่ยเขาก็จะใช้ PRP เนี่ยในการทาเข้าไปนะคะโดยไม่ต้องฉีดก็จะทำให้มีการดูดซึมดีขึ้นก็คือเราสามารถใช้เลเซอร์เป็น drug delivery system ได้โอเคค่ะ now it's time up Dr. Rosso so on behalf of our Thai doctors thank you so much for your kindness who run across the world to give out the knowledge please give him a big hand please
Thank you for the invitation Thank you
เดี๋ยวก่อนนะคะขอแจกของฟรีนิดนึงค่ะบริษัทเพิ่งให้อันนี้มาบอกว่าช่วยประชาสัมพันธ์นะคะคือทางที่บูธ Technical Biomed นะคะจะมี Grab the chance to win lucky draw นะคะโดยแจกนะคะโอกุระ and up and above international buffet lunch for 2 person นะคะ buffet ฟรีที่โรงแรมโอกุระ
2 ท่านนะคะไปกับกิ๊กหรือไปกับแฟนก็ได้ค่ะเลือกดีๆอย่าให้ชนกันก็แล้วกันนะคะ process ง่ายๆค่ะไปที่บูธของบริษัท Technical Biomed นะคะแล้วก็จะสแกน QR code ค่ะก็จะได้มีสิทธิ์ลุ้นรับบัตรฟรีนะคะ2 ท่านค่ะขอบคุณค่ะ
Thank you.